smoking for about 7 months now.
I stopped smoking 4 months ago.
I quit smoking 6 months ago.
Kick the Habit is a partnership project between NHS Greenwich, Charlton Athletic Community Trust, the Football Foundation and Greenwich Council.
Greenwich Healthy Living Service is part of the NHS and it's a free lifestyle support and advisory service for local residents to help them with different areas of their life where they might want to make some improvements to their health. So for example, stopping smoking, eating more healthily, being more physically active. And the services that we provide have a whole range of support that local residents can access to help them to improve their lifestyle.
It's really important to have services like Kick the Habit in Greenwich because we've got really high rates of smoking in the borough. So if you look at the whole of the adult population, probably a quarter of the population in Greenwich smoke. But actually if you look at particular groups and if you take men who are in manual jobs in particular or unemployed, then the rates of smoking become really, really high and are almost up to 50%, which is the highest in London.
So most people make the link between smoking and cancers and some respiratory diseases, but not many people make the link between cardiovascular disease and smoking. And smoking is a major cause of cardiovascular disease, such as heart attacks and stroke.
Charlton Athletic Community Trust uses the power of football and the badge, of course, of Charlton Athletic to engage people in their local communities alongside partners to help improve lifestyles.
The community programme at Charlton started in 1992, just after the club returned to the Valley, and there's something in the region of 100 part-time delivery staff working on the ground across a variety of different sports and specialist programme managers and leads as well.
There are lots of community outreach elements to our work, and Active for Health is one, which is our physical activity programme. Kick the Habit, obviously, very familiar to everybody involved with Charlton, is another way in which that outreach happens. Our community cookery clubs and a whole range of our other services that are provided are delivered, very much with that community outreach focus as well.
We have trained up a lot of the Charlton Athletic Community Trust staff as Stop Smoking advisors. They've taken level 1 and level 2 courses, and they are equipped with the knowledge and skills to help people when it comes to quitting smoking. But there are also staff that have been trained up as health trainers, and they can also help people in other behaviour changes, such as healthy eating, helping people to improve their diet, helping people to increase activity.
Our main aim is to sign people up for the Stop Smoking groups, which are run here at the Valley, and they meet as a group, which are more likely to quit smoking as part of a group.
I've saved loads of money.
I would recommend it to everyone, anyone who smokes.
7 weeks of absolute brilliance. Best thing I ever done joining the smoking club. Friendly, people were nice, can't fault them.
People are great, they have fun, they enjoy it. And I've had people say to me, I'm back here this week because I didn't want to let the group down.
Hold it in, keep holding it in, and that's going to 2, 3, go.
I'm sure he does this on purpose, just so he gets a kiss, didn't you?
When I first started the project, there was probably a team of 3 people and 1 clipboard. Now we've got a team of nearly 20 staff. The big bus you see, the clipboards and the data that we catch, the people that we see, it's just growing and growing.
A mobile service that tours the borough, so we go to 5 locations throughout the week, and people can just come on board, have a lung age test with us, and if they want to they can quit smoking then and there, particularly if they feel their lung age is bad. Sometimes that can be a real motivator for people to quit, and they just come along every week from then on, and we can offer them free support, so it's very easy. And we've done 11,000 lung age tests to date, and we've got hundreds of people signed up to quit.
If there's somebody that's very inspirational or having a bad week or struggling, you'll always have somebody else saying, oh, don't worry, try this. Don't worry, try that. I've done that before. Oh yeah, I feel like that. And if they all know they're feeling that way, then they actually think, I can do this.
With the group, I knew it wasn't only me that was in that situation, and there were people that tried other things, sweets, fruits, and I did that, and that worked for me.
Outreach work is all around the Greenwich Borough. We target from high streets to car parks. We also go into local businesses, colleges, universities. We run wellbeing days for staff and for students. Everywhere in the borough we'll pop up somewhere.
Charlton Athletic engages with about 7,500 young people on a weekly basis. Since the Kick the Habit project has started and the Lung Age Roadshow, we've engaged with a further 2,000 people on a weekly basis, which is fantastic. And obviously those people go home and spread the word, hopefully with friends and neighbours, which is, can only be good news.
White working class males predominantly, which are a large cohort still of the football supporting public, are traditionally those that won't access the services of traditional health services without perhaps support and guidance, and that's something that the Kick the Habit team have been able to do. I think it has that particular hook with the local men in the population, and if we can use that hook to guide them towards a healthier lifestyle, then brilliant.
We know that if you smoke, you're at increased risk of heart attack and stroke, twice as likely to have a heart attack or a stroke if you smoke. If you're under 40, you're 5 times more likely to have a heart attack if you smoke compared to a non-smoker. The best and the most important thing you could do if you smoke in terms of your cardiovascular health is to stop smoking.
We've got high rates of heart disease and cancer, and particularly amongst men we've got quite poor life expectancy, and smoking is part of what's causing that. So it's really important that we really find ways of getting out and reaching those men.
I found quitting in the group very helpful.
I've stopped smoking, cut it straight off there and then.
Giving up smoking is one of the best things I ever done. In fact, it is the best thing.
I feel wonderful.